Okay. So we have to discuss about the urinary tract anti-infective agents. And under this category, quinolones, SAR of the quinolones, nalidixic acid, norfloxacin, enoxacin, ciprofloxacin, ofloxacin, levofloxacin, smarfloxacin, datifloxacin, moxifloxacin are to be covered. And apart from this, some other category of the drugs called miscellaneous category, including furazolidine, nitrofurantoin, and methenamine are also to be covered in the second part of Unit 3, BP601T. So first of all, I would like to emphasize that how this urinary tract infections progresses. Urinary tract infections are severe public health problem and are caused by a range of pathogens, and most of the common pathogen which generally causes the UTI includes E. coli, K. pneumoniae, Proteus mirabilis, Enterococcus faecalis, and Staphylococcus saprophyticus. So these are some common pathogens, and especially Escherichia coli is the chief agent which is generally responsible for UTI. Here in this diagram, an attempt has been made to depict that how this UTI progresses. See this first part, contamination of the particular area with uropathogens from the gut. Generally, these type of bacteria resides into the gut, and from the entry point of the urethra, they generally gets inside, and through the colonization of the urethra and migration to the bladder, they generally progresses. See, this first step is indicating that from the gut, the pathogens are entering into the urethra, and colonization of the urethra and migration to the bladder further progresses. When these pathogens reaches to the entry point of urethra, the colonization and invasion of the bladder and mediated by the pili and adhesions occurs. जो पैथोजन गट से आया और इस यूरेथ्रा के थ्रू इस ब्लैडर में पहुंचना शुरू किया, अब यहाँ पहुंचने के बाद सी द थर्ड स्टेप, कॉलोनीज इनकी बनना शुरू होंगी और इन्फ्लेमेटरी मीडिएटर्स रिलीज होना शुरू होंगे. Inflammatory responses into the bladder will be observed, and the fibrinogen and accumulation into the catheter will also be observed. इसके बाद न्यूट्रोफिल्स का infiltration और बैक्टीरियल सेल का मल्टीप्लिकेशन, और मल्टीपल होने से जो इनका इफेक्ट होगा वो होगा they will weaken the immunity system, and the pathogens inside this bladder will form the biofilm, and this biofilm will cause the epithelial damage by release of the bacterial toxin and proteases as well. So bacterial toxins will be released in this bacterial colony into the bladder, and if the treatment of this UTI is not done immediately, in that case there may be every chances that the bacterial colony may proceed towards the kidney and further more complications may arise. So it is one of the important aspect that we must prevent the UTI, and in case if UTI has occurred, the immediate treatment is mandatory, because failing which the pathogens may reach to the kidney and various other complications related with the kidney may be observed, like bacteremia and kidney problem and pain at the left part of the body as well. In this slide, we will observe that what are some common facts that every student must know. UTI is very common. and significant cause of morbidity and mortality both has been associated with the UTI. When we discuss about the urinary system, the UTI may be between the glomerulus and urethra both. In general terms, when we discuss about the upper UTI, this upper UTI is the infection in urinary tract that is above to the urinary bladder. And when we discuss about the lower UTI, this clearly indicates that the infection is below to the bladder or at the bottom part of the bladder. Now, the question arises, if this is so common, then who are more susceptible towards the UTI? Mostly females are more susceptible than male because the total length of urethra is shorter in females. So there are chances that they may easily invade inside to the urinary system and get colonized. In that case, the UTI may proceed. So, but apart from this, exceptions are in the neonatal boys who are 4 times more likely than neonatal girls to have an UTI, and the reason associated with this is still under investigation and not clear yet. Elderly men may become more susceptible due to prostatic hyperplasia. So, one important fact we can highlight that mostly females are more susceptible towards the urinary tract infections. One female out of 5 female pool will generally have at least 1 UTI in her lifetime. About 80 to 90% of the UTI are caused by the bacteria, which already I have told, that is E. coli. So far as our syllabus of BP601T is concerned, urinary tract infections are to be treated with some antibiotics, particularly quinolones. So people who get repeated UTI may need some additional tests to check their health problem and health conditions as well. Urinary tract infections stay generally into the bladder, which is pouch-shaped organ where urine is stored before it passes out of the body. यूरिन पास होने से पहले जिस पर्टिकुलर ऑर्गन में यूरिन कलेक्ट होता है, यूरिनरी ब्लैडर जिसको कहते हैं, वहीं पे यूटीआई की पॉसिबिलिटी ज्यादा होती है। और यदि इस यूटीआई का ट्रीटमेंट समय रहते नहीं किया गया तो the pathogen which is responsible for the urinary tract infection can travel to the kidneys, and the complicated condition that is called as pyelonephritis may produce, and in that case the fever and back pain is very common symptom, and some other urologist opinion is mandatory while due course of the treatment. E. coli, which is very common bacteria and generally is observed in our intestine, but sometimes they may reach to the urinary tract, and there may be chance that this may cause some infections and infection related problem. What are the various common symptoms of the UTI? Generally, a patient who is having infection into the urinary tract generally feels an urgent need to urinate, and often with only a few drops of urinate to pass. Means a patient with UTI generally tries to urinate but feels very difficulty in urination along with pain. A burning feeling is being observed to the patient of UTI when trying to urinate, and itching feeling, pressure or pain-like feeling into the lower abdomen is observed continuously. Cloudy or blood-tinged urine is also one of the common symptoms of UTI. And apart from this, if the urine is having strong bad odor, this may also be one of the indicators that yes, UTI may be. So timely treatment of UTI is mandatory, and in case if any of the patient gets failed to treat the UTI in time, in that case the pathogen may reach to the kidney and more severe condition may be observed, like pain in the lower back and fever along with the chill symptoms. So what will the doctor do to check for a UTI? Doctor will test a sample of your urine for the presence of bacteria and any of the blood cells and pus cell and all these. So if the analysis of urine with a special reference to the presence of bacteria, blood cells, pus cells and other cells are done, the analysis is called as urine analysis. And in order to treat, it is also one of the common tests that antibiotics are also to be tested against the culture, that which particular antibiotic will be effective to treat the bacteria or the pathogen which has been caused the UTI in a particular patient. So if an infection does not clear up with the treatment, or if the frequency of UTI is more, in that case doctor or the physician whom you are consulting may refer to the urologist, because a physician who specializes in disease of the urinary tract may diagnose it more better. And apart from this urine analysis and different tests, ultrasound examinations are also to be done for the kidney and urinary bladder. A cystoscopic examination are also to be done, in which a hollow tube with special lenses are inserted into the bladder to observe any kind of anomaly if available, if present. Sorry. And UTI are definitely to be treated by the antibiotics, and the doctor generally recommends an antibiotic treatment for a week of 2 or 4, so that absolute cure of the UTI may be possible. And several weeks may be also applicable if the UTI is now being chronic and if the pathogen has reached to the kidney. Apart from this, one very common advice is being given, that is, plenty of the fluids is to be taken, and in general the intake of plenty of the fluid generally causes flushing of any kind of bacteria or the pathogen. So this is ultimate way to prevent the UTI. And in case if UTI has happened, in that case, even though plenty of the fluids intake and the treatment of antibiotics are generally preferred. The people who are having diabetes and having weak immunity system are more susceptible. Apart from this one, the fellow who are having blockage in their urinary tract, in that case generally like kidney stone and other like conditions are there. In that case, urinary tract infections are very common. Apart from this, prostate gland ka बढ़ जाना generally in men generally also causes the blockage of urine flow, and the enlarged prostate generally causes the promotion of UTI. Some infants who have been abnormality of their UTI, urinary tract, in those infants, the possibility of UTI is quite more. So in order to rectify these type of problems, the surgery is recommended, and in case if the patient is generally using the catheter for a longer time, there are every chances that UTI may happen and the bacteria may reach to the kidney as well. When we discuss about the history of drugs, especially quinolones, we generally think about this historical background. Like in 1939, chloroquine was identified as one of the anti-malarial drug, and through the structural modification and some structural differences, In 1958, 7 chloroquinolones as an antibacterial were identified. In later year, in 1962, nalidixic acid was one of the first synthetic antibiotic and was used to treat the various pathogens. And further modification into the structure of nalidixic acid were made, and in 1973, flumequine as first fluoroquinolone was observed, and later on in the year 1983, ciprofloxacin was identified, which is one of the most successful fluoroquinolones. And in later years after 1983, various other third and fourth generation fluoroquinolones came into the existence, and still they are very popularly, very commonly used to treat the urinary tract infections and amoebic infections as well. So based upon the classification, these quinolones can be divided into the 4 category. First category is first generation, in which nalidixic acid, oxonolic acid, pymumadic acid, and in the second generation, norfloxacin, enoxacin, ciprofloxacin, ofloxacin, lomifloxacins are there. And in third generation, timofloxacin, sparfloxacin, gripafloxacins are there. And in fourth generation, clinafloxacin, provafloxacin, moxifloxacin, and gatifloxacins are there. So from examination point of view, the student must know that which particular antibiotics comes under the which generation. Like if the question has been asked that sparfloxacin belongs to the which category, which class of the fluoroquinolones, immediately the answer should be that this belongs to the third generation fluoroquinolone. If the question is that gatifloxacin belongs to which particular generation of the fluoroquinolones, the answer should be it belongs to the fourth generation fluoroquinolones. The characteristic features of these antibiotics, especially fluoroquinolones, has been mentioned into this table. The students are advised to at least go through once. These are some structures of fluoroquinolones like nalidixic acid, norfloxacin, oxolinic acid, pifloxacin, enoxacin, and flumequine, rofloxacin, lomifloxacin, and ofloxacin. These are very common antibiotics, and this covered part, this structure is indicating the quinolone structure, and in order to undergo the SAR related studies, one have to emphasize which particular carbon or which particular nitrogen corresponds to the 1 number, 2 number, and 3 number. This position of nitrogen is considered as 1, this one is 2, 3, 4, and this 5, 6, 7, 8. So this is the position number, and based upon this, we will discuss the structure activity relationships. This is again the nalidixic acid structure, oxonolic acid, norfloxacin, and ciprofloxacin, ofloxacin, levofloxacin, sparfloxacin, and moxifloxacin as well. Now, coming to the mode of action, this is very important, dear students. ये बहुत ध्यान से सुनने की और समझने की जरूरत है, and especially the red highlighted part. The fluoroquinolones inhibit the enzyme that is DNA gyrase. जो DNA gyrase एक एंजाइम है, इसका काम है nicking, adding, and then sealing. Nicking means कट करना, दूसरा पार्ट हुआ इंट्रोड्यूस करना एक नेगेटिव सुपरक्वाइल को, और तीसरा पार्ट हुआ कटे हुए पार्ट को फिर से जोड़ देना, रीसील करना. सो दिस बैक्टीरिया के अंदर पाए जाने वाला ये एंजाइम bacterial DNA gyrase, this generally consists of 2A unit and 2B unit, means 2A subunit and 2B subunits are there. जो ये A subunit होगी, इन A subunit का काम nicking of the DNA है. जो DNA बैक्टीरियल DNA होगा उसको कट करने का काम और लास्ट में सील करने का काम इस A सबयूनिट का है, जबकि B सबयूनिट का काम निगेटिव सुपर कॉइल को ऐड करने का है। सो यदि इस तरीके का काम डीएनए गायरेज कर लेता है, इन दैट केस द बैक्टीरियल डीएनए जनरली प्रोग्रेसेस एंड इंक्रीजेस एज वेल. So if we are using the fluoroquinolones as an antibiotic to inhibit the urinary tract infections, so in that case this fluoroquinolones binds to the A subunit. जो एंटीबायोटिक का जो फ्लोरोक्विनोलोन्स का जो डीएनए गाइरेज का ए सब यूनिट है, ये उससे बाइंड करेगा और ए सब यूनिट से इनकी इतनी ज्यादा फ्लोरोक्विनोलोन्स की एफिनिटी होती है जिसके नाते फिर फर्दर बैक्टीरिया का प्रोग्रेस होना पॉसिबल ही नहीं होगा एंड अल्टीमेटली द बैक्टीरिया विल गेट डाई. Recent evidence indicates that gram-positive bacteria, the major target of the fluoroquinolone action is similar enzyme, that is topoisomerase 4, which nicks and separates the daughter DNA strand after the DNA replication. So the fluoroquinolones are having greater affinity with the topoisomerase 4, which may confer high potency against the gram-positive bacteria. Gram-positive bacteria का ज्यादा से ज्यादा किलिंग करने के लिए फ्लोरोक्विनोलोन्स को अच्छा मानते हैं, because these fluoroquinolones have a strong bonding, strong affinity with the topoisomerase 4. Clear? Now, in human beings, in place of DNA gyrase or in place of topoisomerase 4, in human body, topoisomerase 2 is present. This topoisomerase 2 is present, which is having very low affinity for the fluoroquinolones. तो हमने इससे क्या सीखा कि fluoroquinolones is having a strong affinity with topoisomerase 4, which is present into the bacteria. Fluoroquinolone is having very less affinity with the topoisomerase 2, which is present into the human body. This indicates that the fluoroquinolones are very much effective to inhibit the topoisomerase 4 by binding it with them, and there is very less effect on the topoisomerase 2, means host cell is having very less toxicity. Now in this diagram it has been indicated that this is bacterial DNA, and with the help of helicase enzyme, this bacterial DNA undergoes the unwounding. Opening of this bacterial stain occurs, and afterwards on this unwounded bacterial DNA gyrase or DNA topoisomerase 4 acts. And what this topoisomerase 4 performs, this is the work of topoisomerase 4 unit A. This A subunit is doing the work of cutting, and afterward in this some additional part will be added on this, and after adding this, resealing part will be done by the B subunit of DNA gyrase or DNA topoisomerase. So if we are giving the fluoroquinolone, this fluoroquinolone will inhibit the action of DNA gyrase. Fluoroquinolone हमने दिया और डीएनए गायरेज की एक्टिविटी हैम्पर हो गई, और जब डीएनए गायरेज की एक्टिविटी हैम्पर हो जाएगी, इन दैट केस कटिंग, इंट्रोडक्शन एंड द रीसीलिंग पार्ट ऑफ दिस बैक्टीरियल डीएनए विल नॉट बी अंडरगॉन. So this is the way by which the fluoroquinolone generally acts. So this was all about the mechanism part of fluoroquinolone. Now we should think and we should study the synthesis of ciprofloxacin, one of the important compound of the fluoroquinolone category. And for this, 2,4,5-trifluorobenzoic acid. This position is called as 1. This one is 2, 2, 3, 4, 5. So 2, 4, and 5 trifluorobenzoic acid was reacted with this moiety in the presence of dimethyl formamide, which is resulting into this compound. through the first and through this first step, what is happening? This carboxylic acid is being converted into this esteric moiety. This esteric moiety, and from where this CH2COO C2H5 is coming, from this moiety. CHCOO C2H5 moiety is coming from this part, and after this rearrangement, this structure is being obtained. What happens afterward? This cyclic amine is interacting with this moiety in the presence of butanol and resulting into this compound. Where is the reaction happening? This one of the hydrogen from this NH2 is being replaced, and after removal of this hydrogen, this NH and this cyclopropyl moiety gets attached in this place, and ultimately this product is being obtained. Afterward, after a single reaction with the butanol, tertiary butanol, the compound has been cyclized, and after cyclization of this product, this esteric moiety is obtained, which upon further acidic hydrolysis is converted into this acid form, and afterward by reaction with the piperazine moiety, this piperazine moiety is replacing this fluorine, and on the 7th position, this piperazine moiety is being attached. This is the way of synthesis of ciprofloxacin. My dear students, the synthesis of ciprofloxacin is very important, because still nowadays this drug is considered as prototype of the drug, especially in fluoroquinolones category. Clear? Now we have to discuss about the structure activity relationship of the fluoroquinolones, and when we discuss about the structure activity relationship of the fluoroquinolones, see in the first point at the 4th position. Where is the 4th position? Through this pencil tool, I am just trying to mention where is the 4th position. 1, 2, 3, and this one is the 4th position. In every compound of the fluoroquinolones at the 4th position, 4-oxo group is there. It indicates that in every compound of fluoroquinolone, 4-oxo group is essential. And the now next SAR point is tri-substituted nitrogen. Where is the tri-substituted nitrogen? This tri-substituted nitrogen is at the 1st position. 1, 2, and 3. The 3 substitutions are there of this nitrogen. When we discuss about the structure of sparfloxacin or even the structure of ofloxacin, we can see that tri-substituted nitrogen is one of the heteroatom, and it is essential part of the fluoroquinolone structure. It means for better activity, it must be there. It is essential. The presence of 4-oxo group, जैसा हमने पहले SAR के पॉइंट में देखा, और दूसरे SAR के पॉइंट में ट्राई सब्स्टिट्यूटेड नाइट्रोजन आवश्यक है फ्लोरोक्विनोलोन्स की बेहतर एक्टिविटी के लिए. Next point of the SAR is carboxy group. Carboxy group at the 3rd position is essential part, and in every structure of the fluoroquinolone at the 3rd position, you will see the carboxylic moiety or carbonyl moiety. But there are some structures in which this carboxylic acid moiety, as earlier we saw in the structure of ciprofloxacin and even in the structure of ofloxacin, COH group was there. But modification in the 3rd structure, तीसरे पोजीशन पे इस कार्बोक्सिलिक ग्रुप को हमने चेंज कर दिया और इसको हमने आइसोथायोजोल मोइटी से अटैच कर दिया. So this isothiazole moiety, when this isothiazole moiety has been attached on the 3rd position, the pharmacological activity in comparison to the ciprofloxacin has increased from 4 to 10 times. So again, it is said that yes, 3rd position carboxylic group is important, but This substitution on the third position or the changes into the third position may also be possible. Now coming to the next point of SAR is, in the fluoroquinolone structure, the second ring may also be attached to the pyrrolidone ring at position number 5 and position number 6. So these derived compounds have antibacterial activity which is equal to the malodixification. So where is the fifth position? This one is the first position, second position, third, fourth, and fifth position. So at the fifth position or even at the sixth position, the changes into the ring system may also be done. So this is one of the important SAR point. Now coming to the next SAR point, that optimum substituent at the C1 may be ethyl. You would be able to see जितने भी सारे फ्लोरोक्विनोलोन्स कैटेगरी के कंपाउंड्स हैं, उन सारे कंपाउंड्स के फर्स्ट पोजीशन पे सिप्रोफ्लॉक्सासिन है, सॉरी फर्स्ट पोजीशन पे या तो एथाइल ग्रुप है या एक साइक्लो प्रोपाइल ग्रुप है, लेकिन किसी हर कंपाउंड के फर्स्ट पोजीशन पे कोई ना कोई ऐसी मॉइटी जरूर है. सो वन observation was observed as C1 may be cyclopropyl or ethyl, but if the cyclopropyl or difluorophenyl moiety has been incorporated into the fluoroquinolone structure, potent structure of the fluoroquinolone can also be obtained. So one more point is that replacement of N1 position of the cyclopropyl with oxetine resulted into the increased activity. At fifth position of the quinolone ring, an amino substituent give an active compound. Where is the fifth position? This one is the fifth position. In the cursor, I am trying to depict you where is the fifth position. So on this fifth position, one amino substituent may also be added, which may result into some active compound. Now coming to the position number 6. Here, this is the sixth position. So if the fluorine or any such heteroatom, especially fluorine, is added, so this is essential part of the structure of fluoroquinolone, and you will see that in every structure of the fluoroquinolones at the sixth position, definitely fluorine will be there. So sixth fluorine group is essential part of the activity. Now coming to the position number 7. At seventh position, piperazine moiety is also one of the important structural unit, and without this, the activity may be reduced. So, in most of the fluoroquinolones, the seventh position compounds, the fluoroquinolones is having yes. हम लोग SAR के point number 7 पर थे. At position number 6 of the quinoline ring, chlorine atom seems to be essential. छठे position पे हर fluoroquinolone में आपको chlorine दिखेगा ही दिखेगा. Now coming to the next point, in the position number 7, a piperazine moiety or N-methyl piperazine moiety and pyrrolidine ring generally give some active compound. The screen is showing the structure of p-floxacin. Now coming to the position number 8, at 8th position, fluorine or chlorine compound, chlorine gives active compound. Where is the 8th position? 1, 2, 3, 4, 5, 6, 7, and 8. This is the 8th position. And in generally, the compound is having 8th position carbon, and from this carbon, one fluorine may be attached. But the fluoroxacin is one of the compound in which 8th carbon may also be replaced. And if this 8th carbon replaced with the nitrogen and ethyl fluorine moiety has been attached, the fluoroxacin is obtained, which is also one of the active compound. When ofloxacin is considered, S enantiomer is being observed slightly more active, more potent than its antipod. So these were the points related with the structure-activity relationship of fluoroquinolone. Now some more important fluoroquinolones are also there, like gatifloxacin. In the screen, you would be able to see the structure of gatifloxacin. This is the structure of gatifloxacin. And gatifloxacin is the antibiotic of fourth generation fluoroquinolone. Fourth generation fluoroquinolone, this line is important. And like other family members of this fluoroquinolone, it inhibits the bacterial DNA gyrase and topoisomerase 4. Means cutting, introduction, and resealing part is being inhibited by inhibiting the topoisomerase. So gatifloxacin eye drop may also cause some side effect. Gatifloxacin is generally used in the form of eye drop to treat the various ocular infections, and some other UTI related problems may also be treated by the gatifloxacin. So next is the moxifloxacin, and the structure of moxifloxacin is presented into this way. This is same kind of antibiotic and used to treat the bacterial infections, including pneumonia, conjunctivitis, endocarditis, tuberculosis, and sinusitis as well. And moxifloxacin can be given by the oral route and by the IV route, and even also for the eye drop may also be used for the moxifloxacin may also be used in the form of eye drop. It is one of the broad spectrum antibiotic. This word is important. Broad spectrum antibiotic, and it is active against the gram-positive and gram-negative bacteria both. If broad spectrum word is being used, it is very clear itself. It is clear that yes, it is broad spectrum antibiotic against the gram-positive and gram-negative bacteria both. Next is the enoxacin, and this enoxacin is structurally presented like this. It is being used oral. And again, like moxifloxacin, it is broad spectrum fluoroquinolone, and insomnia is one of the common adverse effects. This line is to be marked up. Insomnia is the common side effect, adverse effect. Next is the lomifloxacin, and when we discuss about the lomifloxacin, the structure is like this. And it is one of the fluoroquinolone antibiotic used to treat the bacterial infections, including bronchitis and UTI both. Lomifloxacin is useful in bronchitis treatment along with UTI treatment. So, one important line is that it is used to prevent the UTI prior to any surgical procedures. If the chances of UTI related infections, urinary tract related infections are more, in that case before surgery, the lomifloxacin is only used to treat that particular kind of infections. And next is the antibiotic of miscellaneous category: furazolidone, nitrofurantoin, and methenamine. When discussing about the furazolidone, it is obviously clear that this is the structure of furazolidine, and furazolidone is a nitrofuran antibacterial agent, and monoamine oxidase inhibitor property is also being associated with the furazolidone, and its bacterial property is based upon the interference with the DNA replication and protein production. तो जब फ्यूराजोलिडीन को दिया जाएगा किसी पेशेंट को, तो इसके नाते बैक्टीरियल डीएनए का रेप्लिकेशन इनहिबिट हो जाएगा और बैक्टीरियल प्रोटीन की सिंथेसिस इनहिबिट होने लगेगी, और ड्यू टू इनहिबिशन ऑफ द बैक्टीरियल प्रोटीन सिंथेसिस एंड ड्यू टू इनहिबिशन ऑफ द डीएनए रेप्लिकेशन प्रोसेस, द फर्दर ग्रोथ ऑफ बैक्टीरिया will be stunted, and furazolidone and its related free radical products are believed to bind DNA and introduces the cross-linking again, which is causative agent to prevent the further growth of bacteria and ultimately leads to the death of bacteria. Furazolidone is used to treat the bacterial and protozoal both kind of infections, and it is used to treat especially the diarrhea also, which has been caused by the bacteria. So bacterial diarrhea can be easily treated by the furazolidine, and common side effect associated with the furazolidine is the low BP and pain-like condition into the joints. So these were some peculiar points associated with the furazolidine. And next antibiotic under the nitrofuran miscellaneous category is nitrofurantoin. From this screen, an attempt has been made to depict the structure of nitrofurantoin. It is used to treat the UTI, especially the bladder-related infections where the pathogen has reached their urinary bladder, and it is not as effective for kidney infections both. So नाइट्रोफ्यूरेंटोइन को केवल यूटीआई के ट्रीटमेंट में यूज करना है और इसको किडनी के इन्फेक्शंस के लिए यूज नहीं कर पाएंगे. एंड दिस नाइट्रोफ्यूरेंटोइन कैन बी गिवन ओरली, and common side effects include the nausea, loss of appetite, diarrhea and headache as well. Nitrofurantoin का mode of action जब हम डिस्कस करेंगे तो nitrofurantoin undergoes the process of reduction with the help of nitroreductase and flavin mononucleotide. This flavin mononucleotide inside the cell is produced from precursors and then converted into the riboflavin, that is B2, and from this riboflavin that is converted to the flavin mononucleotide. And this nitrofurantoin, with the presence of these nitroreductase and flavin mononucleotide, by the process of reduction is converted into the toxic intermediate compounds. And these toxic intermediate compound of the nitrofurantoin generally interferes with the DNA, RNA of the bacterial cell wall and inhibit the protein synthesis. So this is the way of working of nitrofurantoin. Now coming to the synthesis, this is one of the important synthesis. So students are advised to learn and practice this at least 3-4 times, because very simple steps are involved in the synthesis of nitrofurantoin. नाइट्रोफ्यूरेंटोइन की सिंथेसिस के लिए जो स्टार्टिंग मटेरियल है वो है नाइट्रोफरफ्यूरल डाइएसिटेट. द स्ट्रक्चर इज हियर, एंड क्लोरोएसिटिक एसिड. One hydrogen of this acetic acid has been replaced by the chlorine and chloroacetic acid has been observed. And the third important reagent is hydrazine, NH2NH2, and potassium cyanate, KCNO. So all these are reacted in the presence of aqueous NaOH, and afterward the pH is maintained up to 3 to 4, which directly results into the synthesis of nitrofurantoin. The structural unit starting from this ring to this ring is same. It can be seen. The additional part, this is the result of the reaction between 5-nitroperfural diacetate, chloroacetic acid, hydrazine and potassium cyanate. So this was all about the synthesis of nitrofurantoin. Next important compound is methenamine. Dear students, already you have done the synthesis of methenamine in the lab. The common name of methenamine is hexamethylene tetramine, which is also called as hexamine or urotropine, which is one of the heterocyclic organic compound. And the synthesis you have done in the lab is from formaldehyde and ammonia. 6 molecules of the formaldehyde and 4 molecules of the ammonia reacted, and this resulted into the urotropine, that is commonly called as hexamethylene tetramine, that is urotropine or methenamine. Generally, this is basic in nature, and this methenamine is also one of the important compounds generally used to prevent the UTI in some patients. In acidic medium, generally the methenamine gets hydrolyzed into the ammonia and formaldehyde, because these were the important constituent for synthesis of methenamine. So in the acidic environment, ये यूरोट्रोपिन अमोनिया और फॉर्मल्डिहाइड में टूट जाएगा, और ड्यू टू दिस फॉर्मल्डिहाइड बैक्टीरिसाइडल एक्शन इज बीइंग फॉर्म, because the non-specific antimicrobial activity is being observed by denaturing the protein. जब formaldehyde यूरोट्रोपिन से रिलीज होगा तो ये बैक्टीरियल प्रोटीन को डिनेचर करेगा और न्यूक्लिक एसिड को kill करेगा, which will ultimately kill the bacterial growth as well. So methenamine belongs to the family cause called as anti-infective, and it is used to treat the UTI. It will not work for the cold, flu or other viral infections, and methenamine is not effective for an active UTI. It is used instead for prevention if recurrent UTIs are there. So, but some side effects of urotropin are there, like upset of the stomach, vomiting, diarrhea, and stomach cramp, loss of appetite, and all these. So, this was all about the second part of Unit 3, that is fluoroquinolones, especially for the treatment of UTI and some miscellaneous category of the drugs. So this was all about antibiotics or anti-infective agents used to treat the urinary tract infections. Thank you.